Hello, everybody, and welcome to the Feeling Lighter podcast. I'm Coach Tyler, here today, as always, with Dr. Lisa. How are you today, Dr. Lisa?
Oh, very good. How are you?
I'm doing well, and I'm particularly excited today because you know what, like the most coveted job in the world, everybody wants their kids to be, at least this is how it used to be. Say, I want you to be a doctor, right? Yeah, that's a good job. And this person became a doctor and then was like, wait a second, this isn't what I should be doing, and shifted. Right. And so I'm really excited today. Are you?
I am. We are so excited to welcome Dr. Flora Sinha to our podcast. Thank you for being here today.
Thank you for having me. I'm excited.
Yes. Can you just tell everybody?
Slide right in. Yeah. Why you became a doctor? What then? You decided not to. What?
Yeah. So actually, I'm still a practicing physician. So I'm not battling. I'm holding multiple hats here. So I am a board certified internal medicine physician. I am a menopause certified practitioner. I am also a mindset coach and a podcast host myself. So I'm playing multiple roles and loving every minute of it.
I love that. I like that you're still getting to do, what you spent years and, many hundreds of hours training for, because it's cool. It's still a part of who you are and what you do. But I would love to hear the journey from like just practicing traditional medicine. I would love to know like what you started to see clinically and how that sort of, informed your decision to add on mindset coaching to tackle boundaries and burnout and all of this stuff that, we don't usually talk with our physicians about. So how did you even get there? Like what were you seeing that led you there?
Absolutely. So being a traditionally Western trained physician, we focus on treatment. We wait for a diagnosis and then we treat. Well, in primary care, so if you go to your general physician, a family medicine doctor, an internal medicine doctor, a pediatrician, OBGYN, we truly work with prevention. So that is where my heart stays happy, where I can help prevent disease, whether it's mental or physical. Actually, my journey to being a mindset coach came from a personal experience. I was diagnosed with secondary infertility, which means I was able to conceive and birth a child without medical intervention. But when it came time to grow my family, I wasn't able to for whatever reason. And that took me through a really deep roller coaster. It broke me for a little bit until I found the power of mindset work. And I started practicing mindfulness tools and techniques to the point where I got through the experience and came out on the other side thinking that I can apply a lot of these tools and techniques to help my patients. So anyone coming in with dealing with just daily stressors or dealing with a new diagnoses or dealing with lifestyle changes, it is mind over matter to a certain extent. Building habits takes a logistical approach. And so I started using that with my own patients. And then something clicked in me that there is a large subset of high functioning women out there who are holding multiple roles, but not holding boundaries, and they are burning themselves out. And so that's where my journey came in with becoming a mindset coach for women.
Oh, I love that.
Yeah. What a cool story. And thank you for sharing that experience. I think, I imagine some of our listeners have had a similar experience. And one thing I've noticed about our medical field is that it doesn't seem to promote peacefulness as you're going through a challenging experience. And I can think of the birth of my first daughter as such. There was some complications and it was just emergency mode and everything was just really intense. And it caused a lot of emotional harm to my wife, myself, that we had to spend a lot of time processing. And what I'm hearing from you is the mind really matters. And so how do you approach treating patients differently so that when they come in, they're not leaving feeling like they're broken and feeling shame because of all the reasons they showed up, but rather maybe feeling empowered that there's a direction that they can go in?
Absolutely. I feel grateful to be in a position where not only I can educate my patients, but also use this decision-making process as a partnership. So I'm not telling them what to do. I'm giving them options that are data-driven, backed by science, and then also asking them their opinion, which is huge. And so it really differs from person to person when it comes to their willingness to make large lifestyle changes or their willingness to take medication. And we talk about, again, it is a joint decision. So that's where I think the patient empowerment comes in. And also that's where we build trust, right? Um, it's not always something that's built upon in a 20-minute visit. So there's also a system issue here, right? Our healthcare system is broken. And that is what we're working with. So within a shortened amount of time and multiple visits, that's where I try to build a relationship with my patients so we can make healthy decisions together.
I love that approach. And as I'm a physical therapist, and I primarily work with people in larger bodies and in eating disorder recovery. And what I find is that so many of my clients are so broken down from our very broken healthcare system, being a part of it, but they feel so out of control and they feel so kind of hopeless. And they, especially when we go back a generation or two, we're talking to people who sometimes go and see their physicians and they see their physicians like as God. It's like, this is what you say, this is what I'm gonna do. They don't ask questions. I've asked clients before, like, okay, you had a surgery on your ankle. Yeah. Do you know what it was? I don't remember. They don't know the surgeries. I mean, they consent to these medical procedures. They don't know what they are, but they're just listening and trusting this person who in many cases hasn't stopped to ask them about their lives or ask them what's important to them and build that rapport and that trust. So I just think it's very affirming to take that approach as a medical professional in general, but definitely as a physician, because I do think, like Tyler was saying in the opening, go be a doctor. We put this profession on this pedestal, which it is a beautiful profession. I mean, very much respect physicians and all the work, and the learning, but you're people just like the rest of us. And I always tell my clients, like, I may know a lot about muscles and bones and nerves and how things work and biomechanics, but I've never lived in your body. So you're the expert of your body. Yes, to try to learn more about it so that I can help you. So I really appreciate that approach. And I wish that more people had that experience with their physicians, because it absolutely changes the trajectory of a person's health and well-being when they have a trusting, respectful relationship with their medical professional. So, thank you for that, honestly.
I appreciate that. And thank you for saying that we are humans, because oftentimes I think we often forget that we are human beings and we have limits. But I think with social media and the amount of information about just wellness in general that's being thrown out there, a lot of our time is used with just myth busting and utilizing the data that we have to support or not support what's being spread out there. So I think, again, it's nice to open up a two-sided conversation to help patients feel in control. When you said that, they do feel often out of control because they are being told the diagnosis, told what to do, and they just move forward. It's important to open up that conversation and letting the patient know that even though it seems like all these diagnoses are being thrown at you and you feel out of control because this circumstance occurred to you, you do have control over your trajectory. So I love that you pointed that out.
Earlier, you spoke to mindset and how that helped you in your life. How do you apply this to people that are coming to you in your practice, or maybe just as a mindset coach?
Yeah. So a lot of the times we go into victim mode when things happen to us. So personally, yeah, which is fine. It's okay to grieve a little bit. And again, going back to my own personal experience, I was diagnosed with secondary infertility out of nowhere. And so the idea behind meeting my quote unquote life check boxes that were set by my family, my society, my culture. I'm a first generation South Asian here. It really took me into a spiral downward. And so understanding the power of, yes, this sucks. However, I can control my actions, the way I think, the way I approach a really crappy situation. And that could apply to anything in life, right? I teach this to my 9-year-old, where if she's having trouble with conflict at school, I mean, 9-year-old girls, man, the drama, you guys, is on a whole other level. And so, okay, good. So you guys can relate. So just talking her through, like, you know what? We can't control someone else's actions. We can't control our circumstances all the time. However, we can control how we approach the circumstance, how we approach the person, and what we say and what we do. And to lead with kindness and not only to others, but to yourself is kind of the foundation of what I teach a lot of my coaching clients. I always start my coaching clients with how to build affirmations. And it sounds so cheesy and it sounds so woohoo, but there is data that we have neuroplasticity in our brains that we are able to rewire our thinking. So why not rewire how we talk to ourselves and how we think about our own capability before we, go into life, whether that's, from a patient perspective or from a client perspective.
I love that. Yeah, we host these feel-good challenges where one of the elements is helping people reshape the way they believe things about themselves. And I'm hearing you really connect with that. And one thing I've noticed is that if we try to get someone to set an affirmation that is a little bit beyond their actual capability to believe, it just falls off. It doesn't really actually stick. And what we try to do is give people affirmations that feel like a realistic belief to them. I'm curious, when working with your clients, are you trying to start with things that are really simple? Like sometimes I even have people look at me and go, I think I got nothing to be grateful for. I'm like, what about your heart that kept beating, or you woke up and your lungs were breathing all night long, So sometimes we have to start there. And is that where you start with some clients as well?
Yeah, so I start with the generic affirmations, but where I think my clients really excel in is reactive affirmations. So we take that negative inner voice that all of us have in the back of our brains and we name it. We name it because it's not us. It doesn't define us. It's just our protective voice that's not so nice. So whenever that negative voice speaks up, I have my clients make an affirmation that is objective and it's factual and it's reactive to that negative inner voice. So my negative inner voice is named Evilla. I took a little bit of influence from Disney because, why not? So when Evilla says, Flora, you are out of your zone. What are you doing in the coaching space when you're a doctor? Well, my reactive affirmation is I am capable, I am well educated, and I belong. And that is reacting to that negative inner voice, which again is protective to a certain extent. But if we act accordingly, we're not going to get anywhere.
I like that. I like naming it. I like naming the feelings, it's almost like you gave that alter ego.
Yeah.
Like this is a part of me because just like you said, I think it goes back to self-compassion. That part of you is there for a reason. It has served some purpose in your life. It speaks to maybe a former version of yourself, a former trauma, something, and it's trying to protect you. So this is just a very dysfunctional way in which it is working.
Yeah.
and so we have to address it. And it doesn't have to become like, oh, you stupid, like stay away, stop. Those thoughts, we can't control those thoughts sometimes. They're gonna come. So
Yeah.
I appreciate, your approach and in naming it and talking back to. I do the same thing with my clients and I do body image coaching. So it's the same idea. Like you're going to get these ugly thoughts around your body. And then it's like, let's respond, let's hear it. Like, okay, I hear you talking and let's respond in a way that makes sense. And to your point, Tyler, sometimes it can't be like, oh, I am beautiful. I love my body. It's amazing. It's like we baby steps. So, like we'll get there when we get there, but at least at the very least, we can stop having the very, very negative thoughts and neutralize those things so that it's not so powerful.
Absolutely. And sometimes we're not feeling beautiful, and sometimes we're not feeling strong, and that's also okay. Yes.
Yeah.
I like that.
Earlier, you spoke about burnout.
Mm.
And this is something that I see so many people experiencing, especially women, because you got to have the career. You got to be the best mom. You got to be the best wife. You got to have your friend groups. You got to do your therapy. You got to do your workouts. You got to eat right.
He's looking at my planner.
Yeah.
Yes. I'm like, I have my planner right here. It's all there.
Yeah. And it's true that our society lives at a pace that really causes a lot of stress for most people. And the issue, at least that in the way that I kind of see it, is we don't create space for ourselves, right? And we actually say yes to just about everything else. And, usually that's probably because we receive love and attention and compliments and praise because we do that. But then by neglecting ourselves, we're on this downward slope of slowly feeling worse and worse in our lives. So, when you notice somebody coming in who has that burnout, what's the first place you start?
Ooh, that's tricky. So burnout is a state where you are emotionally, physically, mentally exhausted because of the reasons that you mentioned. Being a yes person, maybe you're working in a toxic environment, maybe you have micro traumas, microaggressions. There's so many different reasons. So I really try to pinpoint what the underlying causes are, because burnout is reversible. We just need to take action. I think the most common cause of burnout that I see, not only in myself, but in my clients, is the lack of boundaries, whether it's at work, at home, with themselves. So it's important to recognize what your priorities are at work, what your priorities are with yourself and in your household, and be able to communicate those and be able to be flexible. So if there's a deadline at work, you may not be able to fulfill all of these priorities at home. But it's okay to communicate that to your family or whoever your household members are and say, like, look, you know what? This week is going to be a little busy. I can't make it to all the school events or the after school activities or make dinner from scratch every night this week or whatever your priorities may be. The dinner thing is not mine, but you guys get it. And communicate that. And that way also it leaves a little space for yourself, that you are not building these unrealistic expectations to be everything at all times. We can be everything. We just can't do it all at the same time.
That's so important. I'm so glad that you mentioned the piece around, these unrealistic expectations, because sometimes, and I have 100% been guilty of this, I am a mom of 3, I own a business, I do all the things, and you set a precedent sometimes for like, oh, I'm going to have the gloriously clean home or the, meal plan for the week, and we're going to be on time to every event, and I'm not going to miss a beat. And then you look up and you're like, now everybody in your life is expecting this from you, and there is no way you can keep it going. So this brings me to a question I was thinking about. You posted on your social media your 2025 to don't list. Yes. And I was loving it. I was like, oh, this is so good. But I think it speaks to the conversation we're having around boundaries and knowing like what is within my capacity, what is within my wheelhouse, what is within my bandwidth, and how do I say no to the things. So can you talk about the premise for your to don't list? And if you have it, handy, I would love, for our listeners some of it, because it was so good. And I think it was really it was a cute way of displaying it, but it was a really profound concept behind it, in my opinion.
I think we all have these endless to-do lists, and I think it's wonderful and it keeps me on pace. However, if we can remove some things off of our plate, it will give us the bandwidth to do our to-dos. And so I made this to don't list based off of my 2024. And there were a lot of life circumstances that I again, had no control over that really hit me. And it was a lot of things back to back. And so when I self-reflected, of course, every year is different, every month is different, every day is different. When you self-reflect, you pivot. So that was the inspiration of my to-don't list for this year. Off the top of my head, I think one of my favorite to don'ts for this year is don't criticize before empathize. And it's just a reminder for us to pause and not take everything at face value and to consider the alternatives. And a perfect example is I did a lot of networking last year to help, to build, to market, to do all the things. And I realized that not everyone flourishes in this space of network. When someone says network to me, I freeze.
Yeah.
But when someone right? And when someone goes and says, "Look, Flora, I want you to go to this event and connect." Oh, those are beautiful bells in my ear. I can do that. But when I went to go connect, and if I was responded with a not so warm welcome, instead of automatically self-blaming, like, what did I do wrong? What did I say? Was I not dressed right? Did I not look the part? Or criticizing that other person. Why is this person so mean? Why are they so cold? Maybe think of an alternative. Maybe this person has social anxiety. Maybe this person was overwhelmed. Maybe this person was going through something. Now, that's not to say if this was a repeat incident, like, okay, bye. Like, that's a boundary right there. You don't need to keep, that's a boundary. You don't need to keep entertaining. But just, as a gut reaction, I think oftentimes we're human and we judge and we self-judge as well. And so before we criticize ourselves, before we criticize someone else, let's just take a step back, take a beat, and let's empathize. Another really good one was don't jump on anyone else's roller coaster because yours is crazy enough.
Yes, it is.
I learned this from my daughter, and jumping on her roller coasters with all the ups and downs that she's experiencing as a preteen, where she feels big and then forgets quickly, yet I'm still ruminating and thinking about it. I think that can be applied to so many different things. And I've had multiple deaths in the family last year. I was hit with, other mental health struggles. My father was diagnosed with a really life-changing diagnosis. And I kept jumping on everyone else's emotional roller coaster instead of just riding my own. And it's okay to be there for others, but it's also okay to listen and then step back. And so that was one that I continue to keep close in order to help declutter my brain and help me self-reflect and use my mindset work. Because if we're too cluttered, we don't have the bandwidth to use all the tools and techniques that we learn.
How did you do that? Because I think one of the things I notice, especially again in women, is if someone complains about something, what you're thinking is, how do I help this person ease their discomfort? And then you jump on their roller coaster and you ride along with it, and you're trying to like walk them through how to ride their roller coaster, and then you forget you're riding your own, right? And it just essentially you kind of lose yourself and other people. What was the internal talk? What was the techniques? What was the way that you recognize, holy crap, I'm about to jump on that roller coaster. I don't need to save this person. I don't need to do all these things for this person. I just need to just hear them and empathize with them and then move on and not carry that as a weight around with me.
Absolutely. I ask. So if someone is venting or describing a obstacle or a situation, I ask, what would you like me to do? I hear you. Your situation is difficult, challenging. Do you want advice from me, or do you want me to just listen? Because I'm happy to do either. And most of the time, they just want to be heard.
I do.
That's it. They just want to know that someone is listening to their struggles. And whether you understand it or not, you respect it. And I think that's what most of us are truly looking for when we go to our spouse, our friend, or sibling, or parent, and, start the conversation with, "You never guess what happened today." And you relay struggles, but we also bond via struggles. So I think sometimes we kind of pour more gasoline into the fire per se. And we agree with them, like, I can't believe that person did that. Or, when it comes to health issues, being a physician and being in a family of physicians, having my dad, who's a physician, go through a lot of health struggles, and he was a medical mystery for a while. Um, it, it caused me to ruminate. It caused me to just go crazy because I'm like, I need to know what's going on. How do I not know what's going on as a physician myself? And so by, again, using self-affirmations, by putting distance also with the conversations, knowing that, okay, this is going to be a conversation where this person is going to vent about their own obstacles and struggles, and just nodding. If you don't have the bandwidth to help, if you don't have the bandwidth to relate, they just need the respect. And I think that is so much easier to deliver than advice or, than agreeing behavior. And so at minimum, if we can just respect other people's feelings, emotions, without really needing to put our 2 cents in, unless that's what they're looking for, I think that in itself is a bare minimum act that most of us can do in our day-to-day lives.
See, while I'm not somebody who gives unsolicited advice, I was kidding, we'll make it so. I think that what you just said is such a valuable gift for the people who are listening, and that whenever I have been mindful enough to ask that same question in any dialogue, do you want me just to listen, or do you want my advice? That it just gives you so much clarity. Because I think we walk into situations with this assumption that you want me to solve your problem, and here's, do this, do that, blah, 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 blah. And they're like, now they don't feel validated. They feel like, their feelings aren't, there. And maybe you don't value them in their broken state because you want them to be fixed or something, right?
And it's overwhelming too. It's like sometimes that feedback is just too much.
Yeah. And you're so right that I would say, I don't know, at least 8 or 9 times out of 10, people just want to be heard. People just want to be empathized with and validated and seen. And I think it's such an important thing that we need to do for more and more people. So thanks for saying that big time.
Sorry, there was a little delay. Can you guys hear me?
Yeah, weird.
Okay. I appreciate that. Another one on my don't list was don't doom scroll.
That is such a good one.
I think we've all engaged in the doom scroll, right? Use social media with a purpose and stick to it. That's another thing I go through with my clients. If they are having trouble, just automatically picking up their phone and scrolling, I tell them to do a social media clean out. Oftentimes, we don't need to be following 1,000 people. And we have all these folders of like recipes and travel and things. I know I'm not going back to my folders really very often.
So bad with all the saved things on there. I'm like, what?
Yes. Yeah, we're consuming, right? Which is okay. We're consuming. But the doom scrolling is the addiction part where we need that dopamine boost, which is fine to a certain extent. And when it starts controlling you where you need to automatically pick up your phone and your finger just somehow automatically goes to Instagram and then automatically starts scrolling and you're laughing and you're commenting and you're just doing all the things, all of a sudden 30, 40, 60 minutes go by
easily.
Yeah.
The saddest part about the social media use these days is I think so many people do it, especially at nighttime when they're winding down. And it just fuels disconnect. It fuels disconnect from self, and it fuels disconnect from the people around us. And then we all wander around feeling lonely and rejected. And, if we could just put the phones down for a couple hours at night and actually connect with another person, then absolutely it would really help us in our mental health across the board.
I agree. I think there should be phone-free spaces in our homes. So for us, it's the dinner table. If we're eating a meal together, there are no phones on the table. We are in a dual physician household. So if I don't take emergency calls, my husband does. So he will say, I'm on call. My phone's on the countertop, but it's not on silent. And if there's a call from the hospital, another doctor, I'm going to get up and get it. Again, lines of communication, my daughter understands. Obviously, I understand. But and our bedroom, granted, our phones are being charged on our nightstands, but I actually have a separate alarm clock. So I don't use my phone as my alarm clock in the morning. And
because that starts the scrolling.
that starts the scrolling.
Definitely gotten the alarm on my phone and then grabbed my phone.
Yep.
And then, like you said, my thumb just so
Somehow, how does that happen? I don't know.
And I'm like, oh, what's been happening all night? Like, oh, they missed me. Let me do it. It's sick. It is sick. I agree with you. We also do, me and my kids, there's no phones at the dinner table. Sunday through Thursday. I let them have it on the weekends. But Sunday through Thursday, there's no phones at the dinner table. We're eating together. We're having conversation, and it's just that time, like you said, for connection, because those phones will take you through it. Like you know,
Absolutely. Absolutely.
yeah, and with regard to like who you follow, I'm very big on curating a social media feed that speaks to the best parts of you. So unfollowing, muting, even people you like, and know if what you're seeing is making you feel jealous or angry or, just, enraging you in some way, mute them. Unfollow them. You don't need to see this person every day or their posts or their perfect picture family that you don't have. All of the
Correct.
just let it go. So that's
correct. And that's also a way of taking control, right? You see this person that may elicit a negative emotion in you, and you feel less in control because this person's popping up without you asking them to pop up into your life. Mute, unfollow 100%. That's okay. And guess what? Nobody knows who you're following or unfollowing or muting. It's okay.
Earlier, we talked about how a lot of women especially struggle to create space for themselves. And you said the word boundaries. And we haven't touched much on boundaries yet. And so I want to make sure we do this before this podcast ends. So when you notice someone who has a lack of boundaries and probably needs to start setting them, take us through a process that somebody could maybe use on their own to identify those boundaries, communicate those boundaries, and hold themselves accountable to keeping those boundaries.
So the most common misconception with boundaries is that they are walls too distant, when in reality, they are invisible lines for yourself to increase your bandwidth to connect. And once a client understands that, they're able to hold boundaries with less guilt. And I think feeling this self-guilt is really a major obstacle to holding boundaries for many people. So one of my favorite topics to talk about is boundaries with family members. And I think many of us feel this obligation to have very close physical relationships with our family members, and I'm talking about non-household members, but with our family members because they're blood. And in reality, I think it is possible to connect with our family members, but we are all ever changing, and it's okay if you don't agree with someone or if they're treating you in a way that you don't want to be treated. There are ways to hold your boundary without actually saying you're holding a boundary. Like, nobody wants to hear that, right? Nobody wants to hear, like, hold up, I'm going to hold my boundary now. Right. And so I usually start with, what is the purpose of your relationship? So if we take, a person in your family and you say to me that, look, my purpose is to keep my relationship with this person a healthy relationship. I want this person to have a relationship with my own family, with my kids, my spouse. That gives me kind of an insight of where we need to be and how often we may need to put these boundaries up. So I'll give you guys an example. In our South Asian families, culturally, traditionally, boundaries don't exist. We are all up in each other's business, and that is the norm, and that is the expectation. And growing up here in the United States and just having very large cultural gaps, many of us, I think, have struggled with holding boundaries with our own parents. And so I had a client once who very close with their parents, to the point where the parents were calling like a lot throughout the day, just expecting this person to pick up the phone, listen as they vent or tell them about their day. And I remember this client telling me, I have a family, I have a job, I run 2 businesses, and I run the household along with my partner. I do want to continue connecting with my parents. Obviously, I want a relationship with them, but I can't talk to them 3 times a day. But I don't want them to feel bad because I've told them I had to go, and they immediately responded with, "Oh, you don't have time for us." So
That's not
the
sure.
I mean, So the way we approached it is, again, with the purpose, and 2, oftentimes that resentment has built to a point where anything and everything the person does on the other side is a trigger. So
when we just let it boil to the top. We're like, now change needs to happen.
Yes. And then we just put like this really hard boundary.
Hard stuff.
Yes. And then it just creates more conflict. And then again, another layer. So we try to boil down what are triggering behaviors verbiage where, you know what, it's not worth your mental energy to hold up your boundary statement or a boundary behavior. So if it's like, okay, my mom and dad calling is kind of a trigger based on all the other past experiences, but I do have the bandwidth to pick up the phone. Now, a trigger that my client did not have the bandwidth for is gossip. So pick up the phone and parents are like, guess what happened to blah, blah, blah person. She doesn't have time for that. She doesn't want to deal with it, especially every day, multiple times during the day. So we created a boundary statement. I like sandwich statements, especially for close family members, like parents, siblings, where you say something nice, say your boundary statement, and say something else really nice. Yes, exactly. So we created a sandwich boundary statement for that triggering verbiage of gossip, where my client was like, Mom, Dad, I want to hear this story, but I'm in the middle of work. I love you guys. How about I call you on Saturday and we can chat about what happened with this auntie? And so that way, parents don't feel like they're getting shut down. They still want to be heard. So she's allowing that to happen, but she's taking control over the time and the place and the availability. And that then there's a setting of expectation, right? I'm going to call you on Saturday, which means you got to follow up with that expectation, right? You can't just say it and ghost them, but call on Saturday. Maybe reserve 15, 20, 30 minutes, however much time you need, and listen, empathize, right? You don't need to jump on their gossip roller coaster, and then step back. That way you're fulfilling multiple needs without being available without your control.
That's a very nice boundary.
It is a very nice
That was a
boundary.
polite boundary. I like that.
It is. And I was going to say yes, absolutely. And there is a time and place where if you are in a toxic relationship environment, absolutely, those harder boundaries, distant physical boundaries, absolutely need to be placed. Most of the boundaries we work with are just everyday boundaries with work, with family, with yourself.
Yeah, I think it's important to point that out, though, because it is everybody, like you said, a lot of people see boundaries as like, let me put up the tallest wall I can and stay far away. And it's like, it's not always that necessary. There's ways you can, navigate relationships with certain people. And there are certain people you maybe won't be able to engage with as much. But yeah, I think it's important to know they can be from as super polite as that to, seriously rigid.
Yeah, there's a time and place for it all.
Yeah, absolutely.
This is why we got to work with a connection to ourselves and on the capacity to communicate kindly to others in the first place. Because if we're not connected to ourselves, we wander around and everybody takes up our time. We wonder where our time went. This is because we never had that connection to our values and what's really important to us so that we could spend the time doing the things that we really feel are important to us. Mm-hmm. And so many people struggle with that piece. Do you see this in your practice as well? Just people feeling disconnected and unable to even say like, this is what I need or want?
Yeah, and you're right. I think you got it right when you said, I think there's a lack of self-confidence in some who struggle with holding boundaries, they don't feel worthy. And that is also something that we work on. I'm actually building a boundary course right now, and the first half of it is the affirmation part, knowing that you are worthy to have time for yourself and have space for yourself. And that is incorporated through so many different actions, boundaries being one of them. But there is a way to communicate in a kind, empathetic way, but also have your needs heard and followed through. It takes practice. And look, I've had clients where we're like, okay, this is what we're going to try out. And they came back and they're like, oh, nope, that didn't work. And so we pivot. And that's okay. And it's not perfect. And I also want to add this very important piece is when you start holding boundaries after a period of time where you haven't and no one's used to it, the response may not be all positive. So be ready.
Probably won't be.
Be ready. And eventually, I think if this is a true connection, a true relationship, I think that will beautifully develop. But give it time, give it space, give it patience, consistency, practice, be ready to be flexible and pivot if, you're not feeling so comfortable with the outcome.
That's good.
I'm so happy you brought up
Yeah.
the self-worth piece as the foundation of that, because we can't show up for ourselves if we don't value ourselves. And we see that all the time with people who come in here. They usually come in because they have a ache, pain, injury, and the workouts aren't working for them. And they come in and try something out. Oh, look, this is focused around movement. And they're like, yeah, great. And now let's connect with how the body feels. Okay, let's connect with your belief systems about why you're doing this in the first place, right? And as we go deeper and deeper, we just find so many people don't value themselves. And that's why they don't take care of themselves or create space for themselves.
Yes, and I think there's this message, I think, in our society over social media where more is more. And yes, I think there's a time and place. I went through residency, more had to be more at that time. We had to learn so we can help treat humans. But even within that realm, without rest and reset and self-reflection, that more and more is going to lead to burnout. And that could be a risk factor for other mental health struggles.
That's so important to tell people about. Well, Dr. Flora, thank you so much for your time, sharing your wisdom with us. And where can people learn more about you if they're interested?
Sure. So I'm primarily on Instagram at Dr. Flora Sinha. That's at Dr. Flora Sinha. I also have a podcast called The Beyond Podcast where we talk about things beyond our labels and try to break stigmas and open up great communication over hard topics. So I'm on that podcast is on Apple, Spotify, whatever your listening platform is. So thank you for having me. I really enjoyed this conversation.
Thanks for your time.
Thank you.